right, good morning. I guess it's good afternoon now. We just started at noon. My name is Jeffry Gerson, and I'm an optometrist. I'm really excited to be here talking to you about something that I think is really revolutionizing not just eye care, but general health care for all of our patients with diabetes. What I'll be talking about is the Aurora AI, which is the first FDA-approved handheld fundus camera with AI screening for diabetic retinopathy. So real quickly, I want to tell you the objectives of what I want to go over today and talk about. First, understanding the challenge of screening all of our patients with diabetes for any changes that they have in their eyes, and talking about some of the obstacles that they have, whether it's health-related, location, or other factors. I want to talk to you a little bit about the technology of how this can actually be accomplished on a really reasonable scale, and really scaling it up so that more of our patients can get screened. Explore real-world applications, which I think is really important, because a lot of us might think that something for imaging the eye is only for eye doctors, but I would make the case that this has a much broader application to anybody in healthcare at all, that this has a lot of very practical applications, and how we can really enhance patient care through using this artificial intelligence platform and providing services that many of our patients otherwise would not be able to receive. So just to start off, I thought I'd share with you just the burden, the problem that diabetes is worldwide. So there are well over 500 million people in the world with diabetes, probably 30 to 35 million people in the United States with diabetes. And unfortunately, one of the things we know is that these numbers are only increasing. And so as these numbers increase, the burden of care or taking care of all these people with diabetes obviously will only increase. And that's both here and around the world. And interestingly, some of the places with the most increase in prevalence of diabetes are in third world countries, underserved areas where people generally don't have as good of access to healthcare, which really makes the screening process that much more important, so that we can catch cases that need to be referred on and potentially treated sooner rather than later to try to prevent catastrophic outcomes. We probably all know about some of the different complications that go along with diabetes, and so we have some of them listed here. We know that cardiovascular health is dramatically impacted by diabetes. Luckily, with some of the newer medications, this seems to be decreasing some, but we know that people with diabetes are at much greater risk of suffering from a heart attack. We know that people with diabetes are at much higher risk of cerebrovascular disease, in particular having a stroke because of either the hardened or enlarged blood vessels in their brains. We know that kidney health is also a really important factor in diabetes, and diabetes is one of the leading causes of kidney failure. And lower limb amputation, I think this is one that sometimes gets forgotten, but it's a serious complication for those that do suffer from it. Now, the one that's closest and nearest and dearest to my heart is blindness. And unfortunately, diabetes is the leading cause of blindness in working age Americans. And really the sad part of it is the vast majority, between 90 and 95% of the cases of blindness, are completely preventable with early detection that leads to earlier treatment. So although this is potentially the worst complication, it's most likely the most preventable with appropriate screening. So real quickly, what is diabetic retinopathy? So again, it is the leading cause of blindness in working age adults in our country. Basically what it is, it's a way that diabetes affects the small blood vessels in our body, and in particular in our eyes, and can cause leakage. And so it can cause leakage of blood or other fluids that can ultimately affect a person's vision. We know that both people with type 1 and type 2 diabetes are at risk of developing this diabetic retinopathy. And we also know that the worse someone's blood pressure or blood sugar control are, the more they are at risk. The truth is that at least half of people with diabetes will at some time develop diabetic retinopathy. Another truth is that the vast majority of those never get diagnosed, because they either don't go to an eye doctor or it's just missed during a clinical exam. Again, bringing up the importance of AI-driven screening to be able to find appropriate cases that may not be otherwise found at all. So who needs to know about diabetic retinopathy screening using AI? And I would tell you that you do. If you are here, you're involved in healthcare. I don't know, I may be the only eye doctor here, but what I would tell you is that this is probably more important to all of you than it is to me as an eye doctor, as far as understanding the cycle of how we can screen and identify people with diabetic retinopathy and ultimately help prevent them from losing their vision and their independence. So that's why I think it's so important for everybody outside of eye care to really understand how this works and where you can fit in the screening process in helping your patients. I also think probably the most important point to understand about diabetes and diabetic retinopathy is people can have really bad eye disease and really good vision. So I was talking with someone yesterday, and I even said that one of the worst things for someone with diabetes in their eye care is if they go to their regular doctor's office and they look at an eye chart and they have good vision. Because good vision only means you have good vision today. It doesn't mean you'll have good vision tomorrow. It's the screening for diabetic retinopathy that helps you understand, will I have good vision tomorrow or somewhere down the road? And so because of that, diabetic retinopathy is oftentimes a silent thief of vision, because people think they're doing fine, even though they have dramatic disease, until all of a sudden they're not, and it may be too late. So again, bringing home the importance of earlier screening, because so many people lack the awareness of the potential devastation that this disease process can have on themselves or their patients. So again, the more screenings that happen, the more cases of diabetic retinopathy that get uncovered and ultimately followed appropriately and treated when needed to prevent severe complications. So we know that early detection is vital, just like so many other health conditions. Ultimately, the best predictor of outcomes is how somebody's doing when they initiate their treatment in diabetic retinopathy. So when it's caught early, people end up doing better. If it's not caught until somebody notices they're not seeing well or they're having severe problems, those are people that don't end up doing nearly as well. And so that diabetic retinopathy may have been years in the making without being picked up by an eye doctor or by screening elsewhere. So what we know is with earlier screening, ultimately we have better outcomes. So through earlier detection, we have better outcomes. And these screenings oftentimes really need to be happening outside of an eye doctor's office, whether it's in a primary care physician's office, an endocrinology office, at a health fair, at meetings like this. These are all opportunities for us to be able to screen people to detect otherwise unseen disease. So that we literally have opportunities all around us. With the 12,000 or so people that are here, there are several thousand people that have diabetes that could be screened and ultimately pick up cases of eye disease that they otherwise may not know of. So what are some of the challenges for us in diabetic retinopathy screenings? So again, some of it is just lack of access. If somebody calls my office to get an appointment, they're told, well, the next available appointment is 3 months. And if I didn't understand the severity of why I'm needing to go to an eye doctor, I might just put it off. And so with more difficult of access, less people get in to see an eye care specialist. So obviously more people are seeing primary care providers and other providers than they are their eye care providers. And there's other logistical issues depending on where people live, the providers that are even available in their locality. There's many, many reasons why oftentimes people don't have access to specialty care. It could be insurance reasons. So we know that there are many, many different reasons why people may not have access to specialty care, yet do have access to more primary care. We also know that the referral process to specialists can be time consuming. To make the referral for patients to get in and to actually keep that appointment, and all of these steps along the way that make it more difficult are steps that interfere with earlier detection and earlier, or at least early enough, of intervention. So what I want to introduce to you today is the Aurora AI. So again, this is the first and only FDA approved handheld fundus camera using autonomous AI for detecting mild or greater than mild diabetic retinopathy. So what's really impressive to me about this is with this instrument, we have over 90% sensitivity and over 90% specificity, and the ability to image over 99% of people attempted. So With that high of sensitivity and specificity, it means we don't have false positives. If it identifies someone as having diabetic retinopathy, they do. We also have very few false negatives. If it says somebody doesn't, then it's very likely that they do not have more than mild diabetic retinopathy. I should mention that I'm saying mild diabetic retinopathy. And why that's so important is because if someone has very, very mild, that's something that doesn't need immediate intervention. It's the people that have more severe that need to be identified very rapidly so they can have appropriate referrals for potential treatment. So it's not necessarily finding everybody with diabetic retinopathy. That's not what's so important. It's finding people that have enough to where at this point we know it already really matters. So again, a very, very sensitive, very specific AI-driven device that can be used in, I almost said any healthcare setting, but the reality is it can be used in any setting. It can be used here, it can be used at any type of screening for helping to identify patients with more than mild diabetic retinopathy. What's also really impressive is it's incredibly fast and easy to use this and get results. It'll take me longer to describe it to you than it takes me to image a patient in my office. It literally takes less than a minute for me to be able to use the device to capture an image, for me to send it to the cloud, for it to be analyzed, and then a report immediately sent back to me basically saying, is more than mild diabetic retinopathy present or not? And again, it literally takes less time than it just took me to describe it to you. And so that's really, really important for a lot of different reasons to have something that's that accurate and that quick. So to me, that's really the definition of efficiency, right? Something that works really well and works really quickly. Because if you're sacrificing one for the other, it doesn't really matter. And in this case, we have both. So what it can generate besides just a yes or no answer is a report like this. So when this is being done out in the general healthcare community, this is a report that can then be sent to the primary eye care provider's office. This is a report that can be given to a patient. This is a report that can be put into EHR systems. And I think that the part about providing it to a patient is one we shouldn't overlook. What people fear the most in healthcare, and this has been proven through multiple different platforms, multiple different questionnaires and studies, people fear losing their vision, especially people with diabetes. General population in general, yes, but specifically people with diabetes, what they fear most is losing vision. And that's part of what makes this so powerful, is that it really shows somebody that, okay, we have an AI-driven device that is saying we need to get you to an eye care provider. You can look at the pictures if you want, but this is a really great educational opportunity for making sure that people follow through with appropriate referrals. And so that really shines a light on the importance of on-the-spot screening and referral right there. This is not something where you wait a day or two. There are people that are trying to do this in offices where they take a photo, they send it to somebody, and they get an answer back the next day. It's too late. That was reasonable 5 years ago. That's no longer a reasonable modality for us to be doing the screening, because now we can have instantaneous results. So it allows us to have an answer, show it to the patient, and then make the next appropriate steps while they're there. And ultimately what this impacts is your patient's quality of life through their vision. Because when caught early, people have really good outcomes. When caught too late, diabetic retinopathy, people have poor outcomes. And as I mentioned earlier, between 90 and 95% of the poor outcomes could be avoided through earlier detection, referral, and intervention. So one of the things that this device really helps us do is not just identify patients that have a problem, but identify urgency for referral. Again, if somebody is seeing well, they assume their eyes are healthy, and if they're told they need to go to an eye doctor, there's no sense of urgency. And so this allows us to really be able to show a patient, here's what we're seeing, and here is the urgency of the referral. That, we want to make sure you get seen within the next few weeks, not within the next year or two. And really helps with the follow-through. It's really interesting that despite fearing vision loss, people with diabetes oftentimes ignore referrals to eye care providers. Even when I see somebody and I see a problem that needs treatment that I need to refer them to, if I refer them to a specialist for treatment, a third of the time they never go the first time. And then if they go the first time, half of them don't show up the second time. So there's really a lack of understanding of urgency. And I think that a picture can be worth 1,000 words, and that when we share this with our patients, it makes a huge difference in getting them on the right track of what they need to do to take the best care of themselves. And this slide is really just to illustrate it doesn't matter what your function is in the healthcare community, there's a reason for you to care about this. You don't need to be a physician to care about this. You could be a CFO and care about this because of the codes that can be used and the revenue this can generate. Or you could, if anyone in administration of any type, because of all the different facets of how this really improves healthcare delivery. It's not just any one thing or one area that this has impact on. It has impact on a much greater picture for your patients with diabetes. Diabetic retinopathy could be one of the earliest signs of someone's diabetes in general, or it could be an early sign of their treatment being inadequate. So ultimately, it could help us to identify patients that are having deeper problems and could create incredible cost savings to the healthcare system and the individual patients when we find this earlier. So benefits to your healthcare system. This is an affordable technology without any capital outlay to be able to use. It's paid for on a monthly basis. You're able to bill. There is a CPT code that generates somewhere around $40 every time you image somebody that has diabetes. And so if your area is like mine, everyone has diabetes, it seems like, right? Or so many people. So we have to understand that not only is this good medicine, but it also makes good financial sense for healthcare systems. Not just eye doctors, for healthcare systems. And then it creates further savings in the healthcare system when you find things earlier before they lead to the dramatic complications that can happen. What's also important is your HEDIS scores, your National Health Plan ratings, your MIPS ratings. All of these can be affected and benefited by doing this screening. So it's a way for you to meet all those quality outcome measures through this device, which is something that if your practice is like mine or your office is like mine, is sometimes really difficult to make sure that you're meeting all these requirements. This is a very simple way to meet that one very, very specific requirement that could be performed by anybody on your staff. I will tell you that when this came into my office, it didn't take me 5 minutes to be able to essentially master it and get good images. Anybody can do this. You don't need a doctor. You don't need a nurse. Anybody can do this. I think that really this is shaping the future of artificial intelligence in eye care. It's really showing the eye care community and really the general health community that screenings can be incredibly effective using artificial intelligence. It also creates innovative collaborations where you have people doing screenings, referring to general eye care providers that then refer to specialists as needed, which I think is a really, really important point. Specialists don't want or need to see patients that they don't need to see. And so this helps direct patients in the correct direction at the correct time. And so it really relieves burden on everybody in the healthcare system when appropriate referrals are made. And then, of course, ultimately having a good health impact on your patients, finding earlier for earlier referral and earlier treatment. So again, I want you to really think about how you can empower all of your clinics or healthcare systems using AI for smarter diabetic retinopathy care, using the first FDA cleared handheld. And I think the handheld part, by the way, is really important because if you're in a primary care office, nothing is stationary. Everything moves around. In my office, we're getting to where everything moves around. You don't want something that sits on a table. You want something that you can hold in your hand like this microphone and take anywhere that you need to be able to take it. And that's really what this delivers in a way that's affordable for practices to be able to implement, that generates revenue, that helps you meet your HEDIS and other quality control measures. And it's all just with something that's really, really easy to use that gives instant answers. So I would encourage you to join the revolution, the Aurora AI, and check it out. You can get yourself image. You can see what it actually looks like. You can see how easy it is to have it done. And I think once you do, you'll realize how this fits into all healthcare settings. Again, not just eye care offices. And it's something that really has and will continue to revolutionize how we provide care for patients with diabetes. I have my email up there, so if anybody has any questions, and then the booth with this is just right around the corner over here if anybody wants to check it out. And the timer says we have 1 extra minute if anybody has any questions. Yes?
You mentioned it's affordable with like a monthly rental fee. Can you ballpark affordable for me?
So can I ballpark affordable?
Like how many practice, how much?
Yeah, so I'm not going to give you I'll give you a wrong answer. So instead of giving you a wrong answer, I'll have you go and ask them for the right answer, because I don't want to mislead you. But what I'll tell you as far as that, I think more important than how much does it cost is what's the ROI. And so if you look at it at a purely financial model, then the amount you pay out is not nearly as important as what you're going to generate from it. And any practice that has even the average or even less than average number of patients that has diabetes, this will turn into a profit center. All right. Well, thank you very much for coming and going late to lunch. I appreciate spending the first part of your lunch break with me. Thank you.